Hi, my name is Ashley Fitzgerald, and today I'm going to be talking to you about the developmental milestones in children from birth to 3 months. Have you ever wondered what your pediatrician was referring to when they mentioned certain developmental milestones? Well, they simply refer to a set of age-specific skills that most children should reach. Although these milestones have certain ages, every child differs, so they might reach it at a different time period. Your pediatricians use these milestones to determine if your child is developing at an appropriate level. Parents should be informed of these milestones appropriate for their child's age and learn what they can do to help their child reach them. There are many ways parents can help promote their child's development, and because all children are different, you should be well aware and able to meet your child's specific needs. I will also discuss some abnormal signs parents should be aware of in their newborn. I have studied these developmental milestones through reading articles and web pages relating to them. I also spoke with a woman I knew who just recently had a newborn about her child's development. Another way I prepared for this speech was by having experience shadowing in the neonatal intensive care unit, and was able to see the children's progress over the time they spent in the hospital. Although there are abnormalities sometimes in a child's development, according to the Boise and Important Milestones articles, the typical milestones of development include the following. Your baby should have more control over their head, and it should become less wobbly. Stretching and kicking should also become more frequent and stronger. When offering your child a toy, they should begin learning to grasp for it. Another milestone is your baby should begin responding to loud noises by blinking, frowning, and making other movements. During this time, your child should begin responding to your voice. Babies at this stage may turn to familiar sounds and voices. During feeding, your baby will also most likely focus on your face. Being comfortable with their primary caregiver is very important at this stage. Your child will also begin focusing on more complex objects and also on colors, sizes, and different shapes. By 3 months, your child may become slightly distracted by different objects and sounds. At this stage, your child will also begin focusing on things 8 to 12 inches away. Communication is also a big factor at this age, and there are many ways infants learn to communicate. Newborns can be very sensitive to the way they are held, fed, or even rocked. You should notice pretty immediately that your child will begin making facial expressions towards you, even mimicking your own facial expressions. Babies will also begin smiling at different people. During this age, your baby may reach for you for comfort and security. It is important at this stage that children are able to recognize the scent of their mother's breast milk, showing their ability to distinguish between different people. Because all children differ, you should become familiar with your child and observe their specific growth process. The effort and relationship that you form with your child is critical to their development. Information from the Mayo Clinic stated that there are many ways you can promote your child's development, including the following. Holding your baby can allow comfort for your child and also help them to learn about you and study your features. Being in contact with your child is very important for them to feel safe, secure, and loved. Speaking freely to your child can begin laying the groundwork for language development. Simply discussing their normal everyday lives helps them to learn language. Asking your child questions and responding to their cues helps them to learn and respond to yours. Just the tone of your voice can communicate signals to a newborn. Changing positions also helps your child learn to work. For instance, laying a child on their stomach and showing them a toy forces them to raise their head and look for it. This helps them to use more movement and learn to respond to your cues. From Kites' article on maternal concerns during early parenthood, I found it important to respond quickly to a child's cues. It is important that your child knows he or she can depend on you when they have a wet diaper and they cry, signaling you to change it for them. When the child is comfortable that you respond to their cues, they are able to form a secure relationship with their caregiver. This quick response helps build a strong relationship between you and your baby. From WebMD, I also found that there are certain things a parent should be aware of that signify their child may be experiencing some medical or developmental delays. If your child is experiencing any of these signs, it is important to have them evaluated by a pediatrician as soon as possible. The signs include not responding to loud noises, not noticing his or her hands, not smiling to the sound of your voice, being unable to grasp and hold objects, and also not being able to support their head. In conclusion, from the time a child is born to the age of 3 months, there are many developmental milestones he or she should have reached. From motor skills to increased hearing and vision, your child should begin being able to communicate messages to you. Since all children are different, their development will vary a bit, but it is important to be aware of the normal growth pattern and make sure they are following it. A personal and loving relationship with your child has been shown to be very crucial to their development. Therefore, it is important to respond to your child's needs so they feel secure and loved. Lastly, parents should be aware of the signs that could signify a medical or developmental delay in the child and speak to their pediatrician if anything out of the ordinary arises. I hope that through this speech you have learned about the developmental milestones children should reach by the time they are 3 months old and what parents can do to support their growth. Thank you.